This is Tuesday Tips. This is our weekly check-in. We go over different topics in plastic surgery, and I get to answer your questions. Thank you so much to all my patients and future patients that are always joining and sending me your questions. I really enjoy it, interacting with you guys and sharing a little bit of the knowledge and education so everybody else out there is well prepared. So this live has to do a lot with that. So if you've seen my stories and my posts from the weekend and last week, I was during the weekend in Austin, Texas, in the Aesthetic Society yearly meeting. It's called the Meet by the Aesthetic Society. The Aesthetic Society is the largest aesthetic organization for plastic surgeons. It combines all of the board certified plastic surgeons that practice aesthetics here in the United States and also internationally. And this is the biggest meeting of the year. It changes city every year. So this year I was able to visit beautiful Texas. Austin is my first time there and I loved it. Enjoyed it a lot. Beautiful people, beautiful town. So it was super exciting to visit a new city and also get to learn so much and also see old friends and meet new friends. So that's always also a great experience. So what did I learn? I learned so many things, but I just put together kind of the key things in each of the topics, like global topics in aesthetics that I wanted to share with you guys, and then I'll get to some questions that can be related to the meet or anything else, okay? So aesthetics is always evolving field, especially in the last few years when we have so much in the industry and so much out there. So going yearly to this meetings, and I mean this is the one that I went for this year, but in December I went to the Florida Society of Plastic Surgeons meeting. For me, it's very important to keep on going to all these meetings from the different societies because this field is evolving and it's important that you and I stay like top notch in everything that's coming out, focusing on the safety, focusing on patient experience and better outcomes, right? So let's start with the non-surgical. Non-surgical world in aesthetics is growing exponentially each day. I feel that every time that I go to one of these aesthetic meetings, it's so much in the non-surgical options that it's growing and sometimes it's hard to keep up with all the new machines, all the new lasers, all the new things out there, the microneedling with radio frequency, with ultrasound, non-invasive lasers and all of this. So I think there is great devices out there, and it's good that we're getting year after year more data to support the devices that we're using. Because when we start seeing the new device is always great because it kind of brings that novelty to the situation, but it's also great to wait a few years and see actually the results and to see actually what it's doing to the patients out there in terms of results and safety. So that's always great. And I think the new cornerstone that we are seeing, we've been talking about this in aesthetic medicine for the last few years. It's not something this year, but I think the options are booming this year, is in regenerative medicine. And what do I mean by that? We were used to seeing just hyaluronic acid injections, biostimulators, but the regenerative medicine focuses on more your body creating like stem cells, exosomes, platelet-derived growth factors, and fat. So we had the opportunity here at Pure to use AlloClay, which is off-the-shelf fat, which is available now for body, and we are one of the few practices in the United States that have had the opportunity to use AlloClay and have it for our patients. So seeing what this regenerative medicine world is doing out there and the things that we can see in the next few years, it is very exciting. And I think it goes along with the goals that or the trends that we're seeing in our society. Over the past few years, we've seen like overfilled faces, overfilled everybody, and that's not the trend, and it's not where aesthetics is going. Aesthetics, it's going to restoring, basically, reversing aging. So that is the regular medicine that we're seeing out there. What things I wanna incorporate that I learn more about, exosomes. I think they're great after microneedling, after treatments to reduce inflammation and improve the appearance of the skin quicker. I think it's a great option, and I saw some great results that the panelists presented on exosomes. So I was very, very lucky to see those results, and I'm looking forward to incorporating that into my practice. Surgically now, switching to surgically, I divided it into different kind of areas. So facial aesthetics, on Thursday, I was all afternoon in a panel of deep plane facelift. Loved it. Panelists from all over the world were presenting on their techniques, so I got to learn a lot about anatomy, techniques, approaches, and I think something that I started to see more surgeons incorporate, but I think I'm gonna start to incorporate more in my practice, is a lateral brow lift. So brow lifts have always been a surgery that results haven't been key on great to offer. We have the open approach. Brow lift means just lifting your brows, basically. With aging changes, the brows go down. That contributes to the heaviness and aging changes in the upper face. So you have the traditional open brow lift approach, but it's a big scar with big downtime. Then we start to see a lot of endoscopic brow lift. And endoscopic brow lift is just small incisions with a little camera and kind of going in and lifting. A lot of asymmetries and a lot of those like surprise look with the endoscopic brow lift that doesn't look very natural. And the reality is, when the brow ptosis or droopiness occurs, really what really changes, in the majority of people, of course, there are cases that need a centrally elevated brow, but the majority of cases we start to see a little bit of drooping of the lateral brow. And the lateral brow lift is a small incision hidden in the hairline, so you can barely see it, and takes care of that little lift in the tail of the brow. Beautiful results when combined with blepharoplasties, taking care of the excess skin in the upper eyelid and lifting just a little bit. That tail gives beautiful rejuvenating results, and combining that with fat grafting to the temples and to the brows, amazing results. And I think I'm going to be incorporating more of that in my facelifts and facial rejuvenation surgeries. In breast, revolution is fat transfer. I think we have great devices with implants, and I still think that implants are a great choice for a lot of patients. But I started to see more fat transfer results with better viability, better transferring take, and also combining it with implants. So you don't have to decide one or the other. Breast fat transfer helps with a lot with camouflaging that implant, especially in very thin patients when you can see a lot of the transition from the chest to the implant. Fat grafting in that area around the implant to make it look more natural gives beautiful results. So I was happy to learn more about all of those techniques to improve the viability of the fat transfer. Body, they call it the rib revolution, and I think that's coming. So what is it about? Contouring your waist by infracturing a little bit your ribs. So I think there is a very large potential for this, especially in very fit patients or patients that do not have a lot of fat, but their torso is a little bit boxy. It is a small incision in the mid-back and just a very controlled fracture of the outer cortex of the rib only, not fracturing the entire rib, just kind of nicking the bone a little bit so the rib bends, and it creates a beautiful contour in the waist. It was explained that you do it on the ultrasound surveillance, so you're doing it very safely, and also is what it's called the floating ribs, so are the ribs that are just lower on your waist, so it eliminates the risk of having any thoracic, pulmonary, cardiac complications. So we're always scared about this fracturing ribs because we don't want to mess with the organs, right? But I think the experts out there in rib reconstruction, rib contouring have found a very safe procedure. So I'm very excited to see what this rib revolution goes to. I think it's a great surgery that we're probably going to start hearing more and more as results go and years come by. Okay, safety. I mean, we're doing it already, and I've been doing it for years, and I think it's still the best device to incorporate to practice. I use it almost every day. I use it with all of my BBLs. I use it in the clinic to monitor for bleeding, seromas, anything abnormal. And what I learned, and I took a course, is to start using it in the breast more. So breast implants, know that FDA have this recommendation of monitoring the implants 5 to 6 years after you get them done, silicone implants, and then every 2 to 3 years to monitor for rupture. What I've seen with my patients and what I've seen out there is that insurances put a lot of interference and paying for this ultrasounds. MRIs, the other option is very expensive, and a lot of radiology centers, you go do an ultrasound of the breast and they just see the breast, they don't see the implant. So I took a course and I'm going to be offering to my patients the surveillance on ultrasound here in the office. It's very quick, just like putting the probe and checking the implant shell for any rupture, and that way we can make sure that the implant is intact and there's nothing else to do with the implants, just continue the surveillance, okay? So I'm going to be incorporating definitely that to my practice and to all my patients with implants, okay? And I think the last thing is continue, and this is not something that I saw only in this meeting, but I've seen in the plastic surgery world, the more networking and collaboration between all of the specialties and all of the countries. I had the pleasure to see panelists from all over the world, from Greece, from Australia, London, South America, Colombia, Brazil. So a lot of great knowledge, and that collaboration for me was mind-blowing, and I felt inspired, and I felt that the specialty as a group is growing and going in a better direction of more camaraderie and focusing on us all learning to take better care of our patients. So I will definitely continue. I'm a member of the society, and I'll continue to expand in the society because I really think it's important. So I hope everybody learned a little bit with me, and I'll get to some questions now if you guys have them.
Okay, let's start on YouTube. We have a question: how long to train glutes and legs after a tummy tuck?
So, I mean, working out after a tummy tuck, I recommend you wait at least 6 weeks, okay? We want that muscle repair to be fully healed before you start doing any exercises. And you would tell me, but I'm talking about glute and legs. Why can't I just do that? I'm not working out the core. Every time that we're working out our extremities, the stability of ourselves and the balance comes with the core. So even though you're not directly working your core, every time you're weightlifting or doing exercises of your extremities, you're actually activating your core. So wait 6 weeks. After that, it is normal to feel a little soreness, a little bit uncomfortable, especially in the first few exercises. So listen to your body, progress slowly, but definitely you can exponentially increase that weight and training to the level that you desire without any limitations at the end.
If you have to change one implant to do due to a capsular contraction, what are the possibility of that happening again? What do you recommend? Do you recommend removing both?
So great question. Capsular contracture, it is a disease or an entity that unfortunately it is a combination of your response to the body, your genetics, and also the biofilm or the environment where the implant is in. So a couple of things that are going to help to decrease the risk of recurrence of the capsular contracture is one, changing the implant, two, removing that capsule that got diseased or contractured, and sometimes changing the plane. So if the implant was subglandular, put it under the muscle, and all of this is to create that new environment to decrease the risk of recurrence. It's never zero, and it is a little bit higher in patients that have had a capsular contracture before. Other thing that I'm going to do to decrease the risk is I'm going to start you in Montelukast, which is a medication used for allergies, but has been proven to help with capsular contracture, and I'm going to put you in that for 6 months after the surgery, and also starting massages early on, 2 weeks post-op, to decrease the risk of recurrence.
Okay. And the next question, Dr. B, is 1 second. Okay. Is it necessary the anchor type lift for a breast lift with implants?
Not all the time. So it depends on the degree of ptosis. And I think this is a great topic for next week because I can go over the different types of breast ptosis or droopiness and the different types of lifts. Definitely the anchor lift is the one that provides the majority or the major flexibility and restructuring of the breast. So yes, if the nipple in comparison to the fold is just below or pointing down, then you probably need an anchor type of lift. And I know that majority of people are like, but I hate those scars, I don't want those scars. Those scars tend to heal very nicely. Really, the areolar scar, it's in between the areolar pigment and the normal skin, so it usually heals very nicely. The one going down, or the vertical limb, usually heals the best. And then you have the fold, which is hidden basically in the fold. So we can talk a little bit about it. It depends on the size of the implant, the droopiness, the amount of breast tissue that you have, and your goals.
Okay. How do I know if you have that? So in reference of the capsular contracture.
Capsular contracture has different gradings, but basically that the breast or the implant feels harder one side than the other, starts to distort or get higher than the other one, and also if it becomes painful.
Okay, what's the lifespan of alloclay once injected?
Very good question. So alloclay is cadaveric fat that has been cleaned up, decellularized, and have all the immunogenic proteins and molecules removed, so your body doesn't react against it. But what it's been seen in the lab and in the clinical studies is that fat, then your body recognizes as its own and starts to build around it and incorporate it in your body. So it's similar, the thought process is similar than when we transfer fat. You may lose some, that window of time when your body's incorporating it, those first 6 to 8 weeks. After the fat, it's there. And after that initial period of time and your body incorporates it, then it's your fat.
Okay. If the breast is a bit harder, if one breast is a little bit harder than the other, but not too hard, is a bit higher and a little bit different, but not painful, any hope that would get better with a pill?
With a what?
With a pill, I guess
Okay.
she's doing reference of the pill for the
capsular
Montelukast.
Yes.
Yeah.
So yes. So basically, on lower grade capsular contracture or capsules have 4 gradings. The first one is a normal capsule. So capsular contracture is between grade 2, 3, and 4. Grade 2 and 3 is what you're experiencing it. So grade 2 is a little bit harder but not distorted. Grade 3 is harder and distorted but not painful. Grade 4 is painful. It's all of the above plus painful. Grade 2 and 3 respond very well to Montelukast and massages.
Hola doctora, en TikTok, ¿qué opina de un tummy tuck con BBL con transferencia todo junto?
Bueno, esto me lleva a hablarte un poquito de la seguridad de esta cirugía. El problema con esta cirugía es que pienso que es demasiado metabólicamente para tu cuerpo. El riesgo de sangrado y tener complicaciones después es muy alto, porque es una cirugía que va a envolver demasiada recuperación para tu cuerpo. Estamos hablando de reparación de músculo, de liposucción 360, de transferencia de grasa y es mucho metabólicamente para tu cuerpo. A mí me gusta hacerla separada. Me gusta hacer el tonito primero, hacer que toda esa reparación del músculo, remover ese exceso de piel y todo eso ya esté sano, y entonces vamos a hacer una lipotransferencia, una lipoescultura 360 y transferencia de esa grasa, y pienso que es mucho más seguro hacerlo de esa manera. Y la segunda razón por la que yo no las combino es por la recuperación. En la recuperación es sumamente importante para optimizar esos resultados. El problema con hacerte al frente y atrás a la misma vez es que no va a haber manera de que puedas descansar sin ponerle presión a algún lado. ¿Qué refiero? Si hacemos el tummy tuck y te haces el BBL y vas a acostarte para no sentarte en la reparación del músculo, te vas a sentar en la transferencia de grasa o te vas a acostar ahí. Si lo haces de la otra manera, te estás poniendo presión en el músculo que acabas de reparar. Y entonces vas a comprometer uno o el otro resultado haciendo que pierdas grasa o que se dañe la reparación y el riesgo de que necesites volver para alguna revisión o alguna otra cirugía es mucho más alto. Así que siempre las cirugías de revisión son mucho más complicadas. Porque hay personas que me dicen, bueno, pero es que tú me dijiste que como quiera voy a necesitar 2 cirugías, pues prefiero hacérmela todas juntas y después si algo pasa, pues voy a la otra. El riesgo de que quede bien, ya una vez está dañado o que necesita una revisión, es mucho menos. Así que yo prefiero hacer los dos, enfocarnos en esa cirugía y en la recuperación para que los resultados sean mucho mejores. Bueno, terminamos. Muchísimas gracias a todos los que se sintonizaron. Thank you so much to everyone that joined in today and all the questions. I've got a lot of questions about breast, so I think we need to do a few topics about breast the next few weeks, so I can go into in detail more of the questions that you guys gave me today, which were great. So thank you so much, and hope this sharing of my knowledge helped people understand a little bit about what's coming out there and the new things that are out there. If you have any questions, please DM me, and I'll be seeing you guys next week on Tuesday Tips. Peace out. Have a beautiful week.